Hi, I'm Cathy Elliott. I am Chair-designate of our forthcoming Integrated Care Board, and I wanted to update you on a number of developments and changes taking place at this time due to the legislative changes coming through. As you know, 42 new integrated care systems are being set up under statutory bodies across England at the moment, and we are one of them. Our advantage is that we are an established partnership, our West Yorkshire Health and Care Partnership, which is our ICS, made up of representatives and organisations from across the NHS, local authorities and voluntary community and social enterprise sector. And we can build from that. That's our foundation as these statutory arrangements come into place. The Health and Care Bill is going through Parliament at the moment, and subject to parliamentary approval, we'll have our Integrated Care Board and statutory organisation set up from the 1st of July. So there's lots of work taking place at the moment, and thanks to so many of you who've been involved in it. One example is our constitution. We went out to consultation, and as you know, the deadline for that was the 14th of January this year. Thank you to all those people who gave 40 responses and the feedback that we've received. Some people gave general themes around their feedback, other people went through the constitution line by line, and I'm grateful to you. That list of feedback was shared at our partnership board on the 1st of March. And in the documents that are in the public domain, you can see our response to that and how the constitution will be developed further based on that feedback. So again, thank you for those responses. What you'll see in the constitution is particularly the development of a new integrated care board, bringing together a group of leaders to decide on the investment of NHS resources linked to our places and linked to our new place committees that are forming at this time. And the recruitment and the establishment of the ICB is in progress. So you had Rob as our Chief Exec Designate and I as Chair Designate as the beginning of that. We now have our place leads confirmed across all 5 of our places. And very recently we had our Executive Directors confirmed. So that's James as our new Medical Director for the ICB, Jonathan as Director of Finance, Bev as Director of Nursing, and Kate as Director of People. And they'll be joining the ICB from April onwards. We're then recruiting for 4 independent non-exec members at the moment, and we'll be able to announce those appointments for the ICB at the beginning of April. We're then looking at the partnership appointments as well. There continues to be a commitment to have those roles and that representation as outlined in the Constitution. We're also working at the moment on place committees. So those are groups of health and care leaders coming together with delegated authority, working together to deliver the best possible care and invest NHS resources together. We are recruiting for independent place committee chairs at the moment. Those are people who facilitate those meetings in working with those place leaders to come together to make the decisions set against the Health and Wellbeing Board's plans. So I'm really pleased to be involved with Kirk Lee's appointment last week, and I'll be working with other places next week to make those appointments. Each place will announce their new place committee independent chairs and members soon, and then we'll announce them as a group across West Yorkshire into April time. So there's lots going on, as you appreciate, and a lot of governance we're putting in place. The other piece of work that started, which was shared at our March Partnership Board, was looking at the refresh of our strategy. Our West Yorkshire strategy is fit for purpose and our 10 ambitions are strong, but we do need to reflect the fact that we're now in a pandemic and our strategy was written before then, and also that there have been a number of changes taking place. Our health and wellbeing boards across places are currently looking at their strategies, and their strategies by place will inform our overall West Yorkshire strategy, and also take into account policy that's coming through. There are a number of white papers out at the moment, including on levelling up and integrated care, that we need to take into account. So if you're interested, please take your part in that refresh. It's very much done in our West Yorkshire way of co-production, and we'd welcome your views as we put that together over the next few months or so. The other thing that's taking place at the moment is the creation of a citizens panel to link alongside our new West Yorkshire Integrated Care Board. And we're really grateful to Healthwatch for coming to help us with that. And also we'll work with locally elected officials to make sure that the approach, the framework and the representation is right. So there's lots going on alongside the business of usual of delivering good quality health and care services. And I'm grateful to everything you're all doing at this time. It's very much appreciated. And I hope that's a really helpful update from me. So thank you and take care.